Hey, welcome. Today, we're diving into something pretty amazing, the science-backed connection between music and medicine. In healthcare, where you've got all this high-tech science meeting real human compassion, music is stepping onto the stage as this surprisingly powerful tool for healing. So let's explore how these sounds are actually changing the game.
And this quote really nails it, doesn't it? It's the whole point of what we're talking about today. The big idea here is that we're way past just thinking music is nice to have. Nope. We're talking about real growing evidence that shows harmonious sounds can have a measurable therapeutic effect on people's health and recovery. Okay, so it's super important to get this straight. We're not just talking about, throwing on your favorite Spotify playlist and calling it a day. Music therapy is a legitimate clinical practice. It's structured, it's evidence-based, and you have trained therapists using music to hit specific, measurable goals. We're talking about helping a patient manage pain or process tough emotions or even get some cognitive function back. So, to really get how this all works, we're going to break this down like a symphony, right, in 3 movements. For our first movement, let's take a look at the incredible neurological symphony that's happening inside our brains whenever music is playing. It's so easy to think of listening to music as just a passive thing you do, right? But what's going on inside your head is anything but. Seriously, neuroscience shows us it's like a fireworks show for your brain. Music lights up multiple different regions all at once. It gets those neural pathways firing in a way that almost nothing else can. So let's break this brain workout down a bit. Music can actually trigger the release of neurotransmitters. Think dopamine, that feel-good chemical. That directly affects your mood. But it's more than that. It actually sharpens our cognitive skills. And because it's engaging so many parts of the brain at the same time, it helps build what's called cognitive resilience. It's basically making your brain stronger and more flexible from the inside out. All right, let's move on to our second movement. This is where we see how all that incredible brain activity actually translates into real, tangible, physical healing for the body. And this is where things get truly transformational. And one of the most powerful places we see this is in pain management. I mean, look at this comparison. On one side, you've got your conventional, often pharmaceutical options, which, can come with side effects. But on the other side, you have rhythmic relief. This is a completely non-invasive approach where rhythmic sounds can literally help synchronize your neural activity, offering a pretty harmonious alternative for managing pain. And this idea flows right into physical rehab, too. Look, the road to recovery can be an absolute grind, but music offers this empowering pathway. It gives you motivation when therapy sessions get tough, the rhythm helps guide and structure your movements, and maybe most importantly, it offers emotional empowerment. It turns what can be a really difficult process into something more dynamic and maybe even enjoyable. Okay, for our third and final movement, let's pull the camera back a bit, because the power of music isn't just stuck in one area. It's being woven into this true symphony of care that stretches across our entire lives, from when we're kids all the way to the final stages of life. And this table just lays it out so clearly. Look how versatile music is. In pediatrics, it's a playful, creative tool that helps kids express themselves when they're going through scary medical stuff. In hospitals, curated music is literally shaping the healing environment, making it feel more compassionate for everyone, patients and staff. And in the really tough world of end-of-life care, music becomes this profound companion, offering comfort, solace, and a sense of dignity during that final transition. All right, for our coda, our grand finale, let's look to the future. Because while the potential of music in medicine is just massive, creating that perfect harmony between the two means we've got to face some real-world challenges. Yeah, weaving music into mainstream healthcare isn't exactly a walk in the park. There are some serious hurdles to clear. You've got to think about the logistics. How do you bring music into a sterile hospital room? There are ethical questions to consider. We absolutely need standardized practices. And maybe one of the biggest challenges, how do you balance a proven therapeutic approach with a patient's own personal taste in music? That's a tricky one. So we'll leave you with this final thought to chew on. As we keep uncovering just how deep this connection between music and medicine goes, you have to ask, right? Are we heading toward a future where a doctor doesn't just write you a prescription for a pill, but for a specific, personally curated playlist designed to heal? I mean, what we've seen today shows that what sounds like science fiction is fast becoming a therapeutic reality. Thanks for joining me.